Okay, so my name is Dr. Erin Bennion, and I am a nursing faculty member from Brigham Young University in Idaho. And I'm happy to be here today and share with you something that I am passionate about, and that is lifelong learning for nurses. So today I'm going to share with you my study entitled Lifelong Learning of Acute Care Nurses, a Constructivist Grounded Theory Study. So this study is a qualitative constructivist grounded theory study that examined how nurses perceived and experienced lifelong learning in their practice. So once they're done with school and they're out there in the hospital working, what are they doing to engage themselves in lifelong learning? Lifelong learning has been established by nursing organizations as the method that nurses will use to implement evidence-based practice. Nurses now are coming into nursing practice more educated than ever before. Nurses are expected to perform tasks that are more difficult, that require higher skill levels than ever before. So this requires that nurses are actively involved in evidence-based practices. And lifelong learning is the method chosen to implement this. The problem is that nursing organizations have established this as the method chosen to promote evidence-based practices, but those methods have not filtrated down to that practicing nurse. There is not a lot of research that is done on lifelong learning within nursing, and a lot of the lifelong learning efforts are geared towards those in leadership positions and also maybe in some specialty positions. But for the average nurse that's working out on the floor, there's not a lot of research or opportunities. All right, so the purpose of this study was to discover and describe lifelong learning of acute care nurses using an inductively derived theory. There were 3 questions asked in this research. The first was, what are the perceptions of nurses regarding lifelong learning? The second, what experiences describe the nurse's pursuit of lifelong learning? And the third question was, what theory grounded in data describes lifelong learning of acute care nurses? This research was conducted at a Southern Utah healthcare organization. There were 20 nurses that were involved in semi-structured interview process. Once the first level of interviews were conducted, the research was transcribed, it was evaluated, and then there was a second round of interviews with all of those 20 nurses until data saturation had occurred. The next slide is going to show us our demographics. So you can see that in this healthcare organization, there was a good range of where these nurses worked. We have nurses that worked in the surgical services, outpatient care, women's health, nursery, medical, surgical. We even had nurses involved in leadership positions and emergency services and critical care. So a little bit of from everywhere. All right, the themes that were taken from this data, there were 6. There were practical learning, hospital-provided learning, clinical bedside learning, learning from coworkers, outside learning barriers, and evidence-based practice barriers. I'm going to go through these themes, but for the sake of time, I want to get to the theory that was developed, and then we'll come back and discuss these themes. So the theory that was developed from this research study was entitled Confined Learning, a theory of hospital-dependent lifelong learning for nurses. And I like this picture because it shows all this theory, and then it is enclosed with the hospital. And that is exactly what was discovered with this study. So if you'll see on the bottom, there's our 6 themes that were discovered from the data, and they are further divided into 3 major areas, and those are the areas that I'm going to go over with you. All right, so the first theme was given learning. Given learning is practical learning and hospital-provided learning. These opportunities were found. They weren't in direct contact with patients. Instead, they still were inside the hospital. Examples of given learning would be simulation. It would be skills day, any classes that the hospital offered, if there were any in-services at a staff meeting. But they were things that the nurses did not go out and seek on their own. It was opportunities to learn within the hospital, and they were given to that nurse. Whether they were required or they were just given that opportunity, they still were in the hospital. With the given learning, the nurses were not in control of what they were being taught. They were not in control at the extent of what was taught, and they didn't have a lot of say in what was provided to them. They were just the recipient of that teaching and that learning. The next one was clinical experience. Clinical experience encompasses clinical bedside learning and learning from coworkers. Now, this is all the learning that happens within the hospital that is within direct patient contact. Nurses reported learning from other nurses, from other doctors and healthcare workers. They also described learning from on-the-job experience. So if they had a patient that had a certain disorder, the first time, they weren't as proficient with that patient as they were the 10th time they had that patient. So they really valued experience and said the longer they'd been a nurse, they felt like the better care they were giving. A lot of nurses also explained learning occurred by winging it and learning through trial and error with patients. All right, so that brings us to the third. It's constraints to learning, and you can kind of see that developing with the first two. The constraints of learning exposes the nurses' dependence upon hospitals for their learning. Nurses were not going out and seeking outside learning opportunities. Nurses were not going out to conferences or to seek classes outside of the hospital. They were not going out to seek what was the newest and latest evidence-based practices available for them. Instead, they had a lot of reasons for why they weren't doing that. Some of those reasons were money, conferences, classes. They cost a lot of money. And especially when you compare to the hospital would offer them classes, those opportunities for free. So you had a lot of money versus free. Most of those nurses are taking that free option. Another constraint was, besides money, was time. The nurses felt like they didn't have a lot of time either on their shift because of their patient load or outside of their 12-hour shift to find out what these evidence-based practices were. Another one was lack of recognition. This I heard countless times in the interviews about how nurses didn't receive a lot of recognition. If they did go outside and go to a class or a conference, nobody ever asked them what they learned or what they wanted to implement into practice. I remember a specific story when a nurse had come back from receiving her bachelor's degree. She came back to work, and she was excited that she had just obtained this degree, and she came back to work, and she said it was very anticlimactic, that nobody said anything. She didn't get a pay raise. She didn't get a congratulations, nice job. She didn't get increased work responsibilities. Nothing changed for her. And so she said, so why should I go and keep continuing my education? It doesn't affect my job. It doesn't affect what I do. So it was really unmotivating for her to continue that education. All right, so what are some impacts from this research? Well, first of all, it decreases the exploration of resources. So if nurses are staying within the hospital, they're using hospital-based resources as their guidelines. Instead of going out and seeking research, they are looking at hospital-established guidelines. And I looked to see who makes these hospital-established guidelines. And it was other nurses within that hospital. And it was unknown whether these guidelines were produced from research or if they were produced from, this is what we've always done and this works really well with our flow. And so that is decreasing that the nurses are going to only look as far as that hospital established guideline instead of going to original research for their source. It also is going to decrease their familiarity with research. If they just get on to their hospital computer and see what that hospital protocol is, then are nurses going to be able to even read original research and be able to implement that into practice? And that goes in with the third, is that it's going to decrease information literacy. And as we really promote nursing education and want to push nurses to be more educated than they ever have, nurses need to become more literate with reading research and being able to implement that into practice. Another problem with this is that it is fighting against all that nursing organizations have worked so hard to implement. Nurses and nursing history, it has been a struggle for nurses to become independent practitioners and to have that respect in their practice as being independent. We have our own research, and even being here at this conference. And so it's limiting nursing innovation, that nurses are still going to be tied down to what that organization has to offer. And now if you work for a great organization that produces great products, that offers great education, great, those nurses are at an advantage. But what about all those nurses that work for organizations that have tight budgets? That falls for a lot of organizations, right? Tight budgets, or that have nurses that have worked there for the last 40 years that have no idea what the latest research is. But that's what the new nurses are learning from those older nurses. So where does this leave the future of nursing? As nursing practices continue to evolve and grow, lifelong learning practices need to also develop, embracing evidence-based practice as the foundation for producing quality care and patient safety. Evidence-based practice is the junction of knowledge, skill, and quality in patient care. The future of lifelong learning for nurses lies in the ability to seek independent learning, recognizing that learning does not have to be confined or dependent upon what an organization will provide. Instead, emphasis should be placed on independently seeking learning opportunities and growth as an important way to continue the evolution of nursing practice. This will ensure healthcare and the nursing profession continue to grow and evolve, providing the best in patient care and safety. All right, is there any questions? You, then you.
So, in this study, did you look at non-teaching hospitals versus teaching hospitals, or for your population?
Right. So this hospital is a teaching hospital. And so it was one healthcare organization, which I think another interesting study to do in the future would be to do several studies around the country to see, is this happening in all regions of the United States, or is this, particular to this one healthcare organization?
And additionally, the state that you're located in, does it require continuing education for your RNs?
That is a good question. Actually, if you are a practicing registered nurse and you fall within these number of hours, you are not required. One thing that was interesting in this study is that these nurses, it's not like they are not involved in continuing education. A lot of these nurses, I had over 75% of my nurses had advanced certifications, which I thought was shockingly high. They had a lot of certifications behind their name. They had taken a lot of classes, but they were all inside the hospital. It was all what the hospital offered. And the hospital paid for all of these. And it was a huge lack of, nobody's going outside to say, I want to study this, or I wonder what research has been done on this subject. That was not being done. Yes?
Do you think, like, if somebody is giving a presentation at a conference, but that same person, because it will be cheaper for the hospital, goes to the hospital to present it, what will be the difference versus getting it inside versus outside?
Right. So, for example, with those advanced certifications, it wasn't necessary on certain floors, let's say pediatrics, it wasn't necessarily that the nurses thought, oh, I want to go out and become pediatric certified. The hospital came and said, you will all be pediatric certified by the end of the year. So does that make sense? So in order, because the hospital said, we are all going to make sure you are all pediatric certified by the end of the year, we're going to bring someone in, we're going to pay for it, and this is the standard that this hospital had. So you can understand that, you know, on the one hand, if you work for a great organization, I mean, that is a great perk. That's expensive, anyone that's done that. But if you don't work for an organization that does that, you're still at that risk of, you know, that hospital based learning. And then what if, you know, it still limits. They're going out and getting that pediatric certification because the hospital said you are going to get this certification. But it's still, they don't have that innovation of thinking, oh, what else is out there? What do I want to do to improve my practice? What do I want to do to improve patient care? It's that desire to build nursing instead of just being acted upon.
So as somebody who doesn't work for an organisation that has that sort of capability, how as a nurse unit manager do I facilitate that lifelong learning within my staff?
That's a good question. I think go back to my story about the nurse that got her bachelor's degree and that nobody said anything. I think there's a lot of ways to facilitate this learning besides having the hospitals come and dictate what you're going to learn. That nurse was only looking for some kind of recognition. It could have been a pat on the back. It could have been, let's see, you went out and got that education. Now let's maximize your education. Let's let you do more. Let's give you more responsibility, more input. It would be great if it came with a raise in pay. That would be fantastic if bachelor's prepared nurses, you know, received that monetary gain. But I don't think that's necessarily something that nurses need to have in order to feel recognized for their education. If you could encourage your staff members to go outside and seek learning opportunities outside, whether they're going to a conference or going to a class, and then they could come back to staff meeting and share what they've learned and, you know, receive that praise for, oh, I'm so excited that you went to that. Give a presentation on the material that you saw, and let's see if we can take some of that original research that you found. Let's see if we can make that, you know, implement that onto our unit and make our unit a better unit. And actually go through those processes that you saw on those that limitation slide. Let's go through those processes and make our nurses more literate on nursing research. Let's have them go out and find original research instead of going to those hospital-based resources, going out to the source and then being able to pull it back and implement that. Those nurses that are making those hospital-established guidelines, great. If that's what the hospital wants to do, now let's make those based on original research instead of based on what we've always done and it's worked. You know, and then you're making those nurses become more information literate.
They have to do a lit review on the research to revise policies and procedures, and then they do staff development for the changed procedure, and on the procedure guideline, they literally have to put the references at the bottom to show that it's evidence-based. So who had any experience in that area or
No, but I think that would be a great another side study on how nursing policies are being implemented. That would be a great research project to see, are they all being, well, now you already know they're not all being established with evidence-based practices, but it would be interesting to see those numbers. I think that would be really interesting.
Yeah, I was very surprised when you said that, because I'm used to the other way.
Right.
Yeah. Okay.
Was this a magnet status?
No. Nope, it wasn't.
Because I think you find a difference with the magnet status.
Yes.
I think your research will really be good with national healthcare qualities because it is so interesting what you're saying and what she said in terms of the magnet status. Is it different? Is it not just what is required by the magnet designation? You know, so in some hospitals, nurses are given higher pay for certification, but it's so interesting that many of those nurses don't care about the $3 increase, and they will not get the certification. They just continue to do what they have to do. It is so interesting.
Right. I really hope through my experience in teaching in my career as a nurse, I really hope to see this change. I think nursing has already really grown, and I am happy to see it is at the point that it is at, but I hope they continue to grow and be independent. I push my students all the time in their simulation events to be able to think, okay, what can you do as a nurse? Let's maximize your ability as a nurse. All your interventions, are you doing everything you can as a nurse to fulfill your role instead of, hurry and run and call the doctor? I was like, no, maximize your role.
In Austria, we have the obligation for further training of nurses. So within 5 years, there's a special amount of further training hours you have to do. And if you don't do it, that afterwards maybe you cannot work as a nurse anymore.
My only fear of that is that hospitals will see that and then say, okay, here's the training we're going to give you so you can have that done. And then you're back to where you started. It's like building that intrinsic motivation. I had the same problem with my kids. It's like building that intrinsic motivation to go out and do that on your own to make nursing better, to make you better, instead of just say, okay, I'm ready. Give me that, give me that training. I'm ready. Yes?
Did you run into, I'm just curious, I worked at an IV hospital in the operating room before I became faculty, and the big push was to use evidence-based practice. So we worked in an operating room. We did go to computer for charting, so they wanted you to use evidence-based practice. There was a whole site, but it was blocked. You couldn't access it. So did you run into that? Like, yeah, we want to use this evidence-based, but hey, we're going to block it because, that person was caught shopping on,
totally.
Whatever.
That sounds so familiar. And these nurses that I interviewed, they, like I said before, they had degrees. I think 3 were associate degree prepared. The rest were bachelor degree prepared nurses. And really over 75% had advanced certifications. Like, these were educated nurses. They go to a lot of training. These were nurses that were involved in lifelong learning. It is happening. Nurses are learning throughout their entire career, but it's just that staying inside the hospital to do it.